Welcome to Aging is for Everyone. I'm Marian Deutschman, and I'm sitting in for Laura Mondello. And it's great to be here because today's topic is alternative therapies for the elderly. And we have some wonderful guests who will share with us the opportunities that we have for creative therapies. Ordinarily, when an elderly person has impairments, the conventional treatment is often medicine or some emotional support. But here we have creative therapies that can make a big difference. And we'll start with our first guest today. When you're dealing with people coping with activities of daily living, Abigail Unger is a music therapist, and she's Director of Expressive Therapies at the Center for Hospice and Palliative Care. Welcome.
Thank you.
How do you use music therapy to have a positive impact on older adults?
Well, music is a really wonderful venue for expression. So it's an outlet for creativity, for activity engagement, as well as for sensory stimulation and socialization. It's a quality of life venue.
So what do you do as a music therapist?
Typically, we assess folks for both their strengths, their weaknesses, their needs, for any opportunity where music can enhance their quality of life or what's going on with them. So it can be across the spectrum if somebody has maybe a cognitive deficit, a language deficit, a social emotional need, or a physical impairment, that we can provide a treatment with music to engage them in musical expression. And that can be singing, that can be songwriting, that can be playing instruments. Sometimes it's receptive as well, so they're listening to music to enhance their mood, provide relaxation.
And do they have to have a musical background of any kind?
Not at all, no. They don't have to be a musician, and they don't have to have any particular inclination towards music. But we know that everyone has a physiological response to the elements of music. So that's to melody, to pitch, to rhythm, to tempo. And we know that we can trigger the physiological responses in people through certain types of music techniques and the clinical application of those techniques. So some folks, we know if we use certain rhythms, it can kind of give them energy and increase alert state and also enhance their cognitive orientation. And just by being engaged in music that's familiar, music that they remember from a certain era that they have a lifetime association with, or that was meaningful to them. Also music, we can trigger emotions and expression of feelings. A lot of times we know that it's hard to use just our verbal resources to express our feelings, but through the medium of music it can be expressed in sound and in the lyrics as well.
So what are some of the techniques that you use, or what would a session look like?
Sure. We use techniques such as playing live music, playing instruments, as well as creating music, improvising music, or listening to music. So a session may look like two people engage the therapist and the individual engaged in singing together, in maybe writing new lyrics to a song that's familiar. Sometimes the sessions can incorporate family members and friends, because oftentimes with certain deficits we're looking to help them facilitate their own social interactions and interpersonal connections that maybe they can no longer do themselves. Maybe language is the deficit and they're not able to verbally express anymore. And we know that with certain rhythmic and speech techniques that we can use through song and music, we can help that rhythmic fluency and some consistency with expression. So the session may be small and just the individuals, or it may have a group, and it's going to look like active engagement in music making. There may be laughter, there may be some emotion expressed. You may see folks relaxing as they listen, or becoming more and more alert and engaged and oriented.
If you have a group, do they stay as a group? Do they do a gig somewhere or something?
They take it on the road. It depends on how good they are.
Yeah.
Yeah, but oftentimes when we do it with a group of folks, a lot of times, as I mentioned, it's for that socialization piece. And so we'll get some people who are either residents in the same environment or family members, depending on where we are. And and have them engage in something, and they don't even need to use words. So they're communicating through music by singing and playing these instruments in a circle, making eye contact. The instruments and the music is the language, so they may be drumming together. They may be adding music where there are silences. They may be filling in the lyrics, and so they're all just communicating in that way.
And what instruments would you have? You said drumming.
Oftentimes we have small percussion instruments. Percussive instruments are very accessible by most folks. So there might be hand drums, as well as we have small shaker instruments. We have instruments that provide vibration as well, so there's that sensory through the feeling and not just through the sound. We have a lot of tone bars. We have things like xylophones and glockenspiels. There's a variety of instruments, and there's also a lot of adaptive electronic equipment that we use in music therapy.
Where do you do this? Where is this? In people's homes?
It can be anywhere. We can do music therapy. If it's privately, it might be in a private clinic, in an office, or it can be in someone's home. Through hospice, it's typically at a facility where they've brought hospice services in, or in their home, or in one of our facilities. It can be in a community center. It can be oftentimes in a senior center. It can be anywhere that the person has brought us in.
So do you also train the family then to continue this in the home environment? Do they do some kind of adapting at home?
Sure. We oftentimes can create sort of a prescription and a dosing almost for a music therapy regimen. A lot of times we do that for folks who might have some issues with interrupted sleep or restlessness at night. Maybe they wake with distress or anxiety or even pain. Once sleep is interrupted, we know that there's a lot of other symptoms that can come off of that aren't managed. So oftentimes we do a prescription for music at night or to induce sleep and relaxation. And that would look like maybe a progressive muscle script relaxation that we walk them through. And then we create music that's their preference, but is also really sedative. So it's going to be a certain type of music, certain pitches and certain tempos that provide relaxation for them. And then we combine it and record that, and we can have family members facilitate that program in the night or when they're having distress or anxiety.
It's fascinating, and I'm sure that if we had the time, we could share some specific stories. So gaining access to this, they would contact you specifically, and at the phone number was 686-1900? Or?
That's for if they're through hospice. But in the community, there are music therapists within the community, and there's a network. And you can look up online. We have an American Music Therapy Association, which would have a directory to music therapists locally and obviously nationwide to provide for just, even if it's just somebody in the community, you don't have to have a specific deficit or specific diagnosis or issue, but it's just a wonderful engagement for quality of life. It's a venue for bringing people together, for engaging as a family. We know that music therapy can enhance mood. It can induce relaxation. It can also enhance memory and recall. It can provide an opportunity for life reminiscence and
Wonderful.
review.
Thank you, Abigail, for raising our awareness of the benefits, both to the person with impairments, but for the family. We'll be right back with the next segment of Aging is for Everyone. Thank you. Thank you so much.
Thank you.
Welcome back to Aging is for Everyone. I'm Marian Deutschman, sitting in for Laura Mondello. And we're continuing our discussion of alternative therapies for the elderly, with the focus now, as you can see, on pets. We know that being around a pet can be very soothing, and I've read that it can have very therapeutic benefits, even for lowering anxiety and stress, and maybe lowering blood pressure, etc. Well, you're the best people to talk about this. So our guest is Alexandra Dufoucault, and who is the regional representative for Therapy Dogs International, an organization I've never heard of. And so you'll have to tell me about that. And she's joined by Barbara Lenahan and the Doberman, Nitro.
Yeah.
Tell us what Therapy Dogs International is. What is it all about?
Therapy Dogs International is an organization that tests and registers therapy dogs. They actually have a very stringent testing process that they use that's their own test. And they're, an organization that provides, guidelines and a means for people to get involved with visiting. They provide, they email you links where you can go visit. Instead of just doing it on your own, you have an organization backing you. They also provide insurance for all of their volunteers. It is a volunteer organization, so anybody that does anything through Therapy Dogs International is a volunteer through them.
But now you're saying there's testing of dogs. I mean, who gets the dogs for whom? What are we?
Dogs are actually people's pets. Whether the person bought the dog with the intent to do therapy work or not is really the person's prerogative. But dogs live with the people. They are the people's pets, and the people decide. What? I think I want to be a volunteer, and I think I want to do something with my dog as well. And Therapy Dogs International is a great way for them to do that. We have a lot of volunteers who, either they're elderly themselves and they're retired and they're looking for something, to occupy their time with, and they like to visit the nursing home. And the impact that the dogs have with visiting the people is so immense that why would you not want to bring your dog? So you can get them tested, get them certified, and then you can visit with your dog.
So you're bringing your own dog, and the testing is done by Therapy Dogs International.
That's correct.
And then the dog has to pass a certain number of tests in order to be qualified and wear that red scarf and that tag. Tell me about that, Barbara.
Well, Nitro has a great personality, and so I just knew that he would be a great therapy dog. He was already well trained because we had trained him ever since he was a little puppy, but he had that personality. He enjoys people, he's very calm, and so I just knew I wanted to test him. So
that's your dog, and you are testing him, and then what do you and the dog do together?
Nitro and I go to Roswell. That's where we have chosen to volunteer. So we go every other Monday and we visit with the people at Roswell. We're pretty well known there now. Probably our favorite floor is the pediatric floor. We go and sit with the kids, and they really know his name and sit with him. And it's also nice in the waiting rooms when people are waiting for loved ones who are maybe in surgery. You're there for hour after hour after hour, and it's just a break. A lot of times a dog will get a person to start to talk about maybe dogs that they used to have, or just
so it's
be a comfort.
It would change the mood.
Absolutely.
So your organization does not provide the dogs.
No.
It tests the dogs.
Yes.
It certifies them.
That's correct.
And the people who own them are either the people with impairments, or, like Barbara, you want to be wanted to be a volunteer. And your background is what?
I'm a dog trainer.
Oh, so that's just a unique kind of combination.
It really is, yes. And Alex.
But you don't have to be a dog trainer.
Oh, absolutely not.
To have this dog certified.
Absolutely.
No,